Cool. Well, thank you for having me. And basically, I'm going to talk through, as Rachel was saying, the 2 courses that we're designing to deliver to you guys twice in September, or starting in September and starting in January. So I'm going to talk about a bit about who we are, in case you don't know us, why you might want to learn about PHM, why you might want to learn about health economics, a bit of an overview of what we'll be covering, how to sign up, and then obviously time for questions and feedback as well. So please do ask. I'm happy to ask for people to ask questions throughout as well. So yeah, just make yourself known. So this is a bit of a wordy slide, but this is us. So Health Economics Unit. We are passionate, outstanding, and collaborative is our values. Our vision is about leading world-class evidence through economics and analytics, all about kind of evidence-based, supporting evidence-based decision-making. And you can normally find us developing models and evaluations and generating evidence to kind of help inform decision making and looking to create positive change. We're full of a variety of different people, obviously some economists, some analysts, some data engineers, and then some comms people, and then some project managers and people like me as well, kind of hopefully holding us all together. We're quite small, so there's about 25 of us, and we're similar in some ways to the strategy unit as we sit under MLCSU. So if you've heard of the strategy unit, we like to call them our big sister. We do lots of similar work, but mostly around a lot kind of more towards economics. So yeah, that's us. So starting off with population health management, I just wanted to go over what is population health management and why you might want to learn about it. I know with kind of systems becoming, ICS is becoming a thing, population health management is becoming more and more talked about. Just wanted to go a little bit through what we mean by PHM and therefore why you might want to learn about it. So this is just, I'm sure lots of you will have seen this before, but if you're new to it, this is the population health management cycle, and it basically, as it says, is a cycle of intelligence-led care design. So you start at the top, where you try to understand your population, and this can be through analytical techniques such as segmentation, so trying to split your population out into different groups so that you can understand more what their needs might be. Then you look into kind of opportunity analysis and targeting. So this will be other potential analytical techniques around risk stratification, so looking at those groups that you segmented, what their risks might be, and then also in terms of impactability, that's looking at how susceptible they might be to particular interventions. So it might be that you've got a group that you really want to target and you think intervention X always does really well looking at this specific disease, but actually for that group, intervention X might not work. You might have to go for a different intervention. So impactability is thinking about that. And then we've got kind of predictive system modelling as well. So this brings in like actuarial analysis, kind of looking at forecasting and predicting risk as well. And then following on from that, we've got kind of the more softer stuff, then followed up by evaluation to start the cycle again. So pulling it all together and pulling together like kind of relationships and all the kind of things that are tricky to understand about how a system works together to build interventions is kind of your number 4. And then our final step in the cycle is evaluating how well you've done and then improving it for next time and starting again. So that's kind of what a PHM cycle generally looks like. That's what we're aiming for. So this slide is just a bit more thinking about PHM in terms of systems. So when we're thinking about PHM, we're thinking about a local system, so integrating care across kind of primary, secondary, community, public health, social, and also third sector. And we're thinking about a specific budget and a specific geographical population as well. And then in terms of PHM, it's how you use your evidence and person level analysis to understand needs and well-being, identify those opportunities, which I was talking about in terms of that risk stratification bit, inform planning and investment with that kind of predictive bit, and monitor and evaluate your interventions with that evaluation-y bit as well. And all of this is in order to reduce your inequalities, achieve the triple aim of health, and obviously think about the longer term. Lots of PHM is thinking about kind of preventative stuff. So yeah, thinking about the longer term for a specific population. And the reason this is all important is because PHM kind of takes that holistic view of the system, and I think this is shown by this graph here. There's lots of different kind of variations of this, but the point is that clinical care only contributes to about 20% of people's kind of health factors, and the rest of it is made up by their behaviours, the physical environment, and socio and economic factors. That 20% in the evidence moves between about 15 and 25, but the point is the same. So thinking about PHM is a good way to influence people's health through a range of different interventions, and thinking more about people rather than specific care, so that we can think about their wider determinants and address inequalities, and like I said, think about prevention as well. So I hope that's kind of made you think, this PHM stuff sounds interesting. So I'm now going to move on to health economics of, yet again, what it is and why you might want to learn about it. So economics is all about how you have a set amount of resources in the world, but infinite needs and wants, and it's thinking about how we match that and get the best out of what we've got with what we want and what we need. So it's maximizing, and then health economics is a kind of applied version of economics. So when we're thinking about health economics, we're thinking about maximizing healthcare using the available resources that we have within a system, country, place, or whatever. So economics is kind of has challenges in terms of understanding concepts and thinking about need versus demand, and quantifying things like behaviours, costs and benefits as well. And all of this is usually done to try and give decision makers more quantifiable evidence that they can make their decisions off, rather than going off, I guess, individual experiences. It's trying to quantify sort of those feelings that people often make decisions off, to address inefficiencies, thinking about that matching of resources to the best that we can get for our healthcare, and also addressing inequities also. So yeah, basically health economics has got kind of increasingly important as demand has increased at a differing rate to our resources. So when the health service was created, the kind of resources compared to demand made it slightly different to how it is today, with the resources that we have compared to the needs of our population. So making sure that we use our resources in the best way is even more important, so that we can understand how we can make good decisions, and then also evaluate those decisions so that we can make them better next time. So hopefully, if that's not swayed you into taking these courses, here's some feedback from some of the sessions that we've run that are slightly, some of the sessions that we've done before that we've tweaked to you guys, so they're not exactly the same, but very, very similar. So this sounds like I'm blowing my own trumpet, but this isn't about me. This is about other trainers in the team. So expert trainer, engaging content. We use lots of examples to try and make things easy, and then we also do lots of practicals and discussions as well, to try and make things solidify and go in, and so that you can come back to stuff that you've done as well. We try our courses both have kind of broad and technical bits, and I think one of the good things about that is that we're trying to get different people together so that they can all communicate with each other and learn what everyone's bringing to the table. So I think there's one in here that says something about everyone brings something valuable, to the table, and kind of it was a safe environment for discussions and things like that as well. So I'm hoping that's persuaded you a bit. But I'm now going to go through the courses. So like I said, we've got 2 courses. A PHM one is a bit longer. They're both structured where you have kind of 1 or 2 hour sessions per week. So the PHM one is 11 weeks where you have 2 hour sessions per week. And then the health economics ones is 5 weeks where you have a 2 hour session per week. There's, for the PHM one, we've got kind of 6 broad sessions and 5 analytical sessions dotted throughout, because we do it as we go through the training as you would go through a PHM cycle. And then the health economics one has 2 broad sessions at the start and the end, and then 3 kind of more technical ones in the middle. As I kind of saying, they're both a combination of lecture style, discussions and practicals. We're starting the PHM one very, very soon. Our first session is on the 5th of September. If not, it's in that week. And then we're running those until December across those 11 weeks. And then the health economics one starts in late September. I believe it's the 29th of September. Through to October, and then we'll be running these again with a second cohort. So if there's dates that you can't come to in cohort 1, then please do come to cohort 2, or if you want to do a bit of revision, I'm sure you'll be welcome to come back. So we'll get some dates in for cohort 2 pretty quickly, but we don't have dates for those yet. One of the things just to mention is that some of the sessions build on previous content. All of that is kind of signalled in, will be on the website. So when you're signing up, you'll be able to see which sessions you need to come along to if you want to go to a later one. So you may need to attend earlier sessions to understand later ones, or have experience in that area. Both is fine. So this is the team on our side who'll be delivering the training. So Andy and David are going to be leading the PHM training, with Santosh, Joe and I doing some of the PHM training. And then Lisa, who I think is on the call, I might get her to come off camera and wave now. And Anna, here we are. Lisa and Anna are leading our economics training, and will do much better job of explaining economics than I will. And they're being supported by Will, who's also going to be running, I think, the first session. So that's us. And then Rukia and I will be, I don't know, pulling us all together, making sure we're all doing the right thing. So I just wanted to take you back to this structure, because like I was saying, the PHM course is made up of this structure. So we kind of start with an overview and then go into this this cycle. The reason I wanted to show you this is because the next slide is all the courses, and it's quite wordy. So just prepare yourself. So each of these lines is a session, and the grey sessions are broad ones, so open to anyone really. And then the blue sessions are specifically for analysts. So the first 2 sessions, like I said, are a bit of an introduction. So we start off with kind of what is PHM, why is it important, some of the bits I've discussed today, and thinking about kind of key methods and an overview of that PHM cycle. We then go on to how systems work together. So this is a lot about thinking about systems and ICSs and what they've looked like before, why they are the way they are, how it works well across systems, and why and when there might be challenges, and some examples of overcoming them and improving wider determinants of health when you work as a system. And then we have our 2 technical introduction sessions. So an introduction to R specifically for PHM. So thinking about like data structures, thinking about linking data and using R for that. And then we've got an introduction to statistics for PHM. So this is not my bag, but yeah, an introduction to statistics. And then we've got, oh, David's here. This is David's bag.
I'll do a little bit at the end if that's all right.
Yeah, no, that's fine. And then we go through the cycle, doing a broad session and then a technical session for each of the bits in the PHM cycle that we want to cover. So starting off with segmentation, moving on to risk prediction and risk strat, and then moving on to impactability. And in the technical session, it'll be causal inference for impactability. And then finishing off with a kind of introduction to evaluation, closing the PHM loop. Do you want to come in, David?
Hello, and thank you so much, Sophie, for the brilliant presentation of this course, which I think is going to be extremely exciting. From a technical point of view, the way these sessions are going to be run is going to be quite interactive. So we want to make sure that everybody has a space to play with what they're learning. We're going to start with introduction to R to make sure that we all have the same foundations, so we can actually do the maths in a way that is robust, rather than trying to bend Excel to do things that it was not really designed to do. So trying to leverage on R, which is a fantastic tool for analysts in the NHS. We'll look at statistics specifically for PHM. That's going to be a nice refresher for anyone who already has a good background in stats, but specifically we'll look into how we can do that in R. And then we're going to get into the more fun stuff. So looking at segmentation. So what does that look like from a maths point of view? So which algorithms are commonly used? Which ones have different strengths and weaknesses? This is a part of my job that I really love, understanding how different approaches should be used in different situations. I believe that there is a lot of art in analytical professions. There are many interesting choices to make that can bring out different aspects of the data. So really getting that understanding is important. And then we'll do the same for risk prediction and stratification. And then we'll even take it one step further to an area which I hope is the next big thing for the NHS. So getting a bit deeper into the causal inference and impactability. So we are starting to get really good at the descriptive part of our job. So looking at the initial patterns and correlations in our data. There's one step further, actually understanding causality between different things. So moving one step beyond correlation. So there's a lot of exciting stuff packed in there. As Sophie brilliantly put it at the beginning, PHM is an intelligence led approach. This is a brilliant time for analysts to shine, to have a moment where we can support the emerging ICBs and the organizations that we work for in a very proactive way. So I'm very, very excited about the profile of PHM Rising, and I'm very thankful for everything that Sophie is doing for us in doing that. So I hope we'll see plenty of you in the sessions that will be coming up in the next few months.
Thanks, David. One of the things to mention about the technical sessions, because obviously now you'll all want to be coming along, because David's fabulous. They are capped at 25, so you'll be able to sign up today, I think, with the link that Rachel sent round in an email. But I think if you're interested, sooner rather than later, to make sure that you can get a space. If you can't get a space, maybe we can. It's only a few more. Maybe we can think about if we can add a few more spaces in. But also remember that we've got cohort 2 to come back to. So yeah, hopefully you can get a space this time. If not, one in cohort 2. Cool. So I'm going to move us on to the health economics one. So we've got 5 sessions in this one, and like I was saying earlier, it's kind of sandwiched by the broader sessions, and then we have the technical sessions throughout. I think in terms of the technical sessions, what Lisa and Anna have kind of asked for is a knowledge of economics and evaluation is beneficial, but not really completely essential. But as long as you have kind of a good interest in this kind of first session, you can come along to session 2. For sessions 3 and 4, these are for analysts, so having an analytical background is preferable here. But yeah, so basically the course starts off with some foundations, and will link nicely with Fraser's course on economics for non-economists. So a bit some recaps here. And then we move on to economic evaluations of service change and transformation programs, and then critical appraisals of published economic evaluations, and then decision modelling for health economic evaluation, and then finally finishing off with kind of understanding equity in healthcare and thinking about those kind of things that I was discussing earlier about need, demand, supply across the health service. So I think in terms of signing up, as I said, Rachel sent around that email to the analytical network, and each of these are links to sign up. So you can sign up to the PHM ones now. I think the health economics ones are coming soon. I might pass over to you, Rachel.
Yeah, so the health economics ones are coming soon. So yes, I sent that email because we were having some issues with our website, and I desperately needed to tell people how to access the courses. So I did it in that email to the Midlands Analyst Network, but it's also available on the website as well. So I put the link for those, you can see it in the chat box. So just go to the training and events page on the Midlands Decision Support Network website, and all the links will be there as well. Yeah, so we've had a few people sign up so far. So I've just got some things in my head, so I'll just keep talking, and then I'll go on to some sensible questions that people have asked on the Menti. So if you don't mind, have you actually finished, Sophie? Did you want to say anything more at this point?
You know what? I was like, I'm not sure. Yeah, I have. Okay, I have.
Perfect. Questions, guys. Yeah. So there's a couple of things. Yeah, we've had interest so far. So we do have a question about are there limits on the numbers? You've mentioned that the more technical ones, there'll be a cap of about 25 people, but there are I think that's a reasonable amount from previous sort of courses. That's quite a lot anyway, and they're going to be done again as a second iteration. But the ones, and those are the technical ones, and now the non-technical ones, there isn't a limit on those, is there? Because it's effectively sort of a webinar style training session.
Yeah, there'll be interactive bits, and also there will be practicals, but we basically designed it so that we can like jump in and out of breakout groups rather than, so that we can have as many people as possible, rather than us having to cap it and making sure we've got one of us in each breakout group. So as long as you're all well behaved.
Oh, I mean, you know, of course. Yeah, no, I'm sure it'll be absolutely fine. I'm sure it'll be absolutely fine. So
yeah,
linked to that, somebody is asking or pointing out that the some of these courses, the non-technical ones, would be very useful for a whole range of people in across different organisations, and so we need to get the message out to them to partake or be aware of this training. And so so that's what we'll try and do that. And some of that is telling your colleagues about it, because I'm not sure of your colleagues who would be interested, and we don't have like a list of everybody. We can kind of like reach out to intelligence function leads, and they can sort of pass it on to people within their systems who they think might be interested. But I think it's some of this is just who do you think would be interested, and just go ahead and pass it on to them.
I think especially sessions 1 and 2 would be really good. And if you wanted to do, if you would just say to people there's one session that you should attend, I think it would be session 2 if they have an understanding of PHM already, just because it's a nice opportunity to learn about, as I was saying earlier, as like ICSs have become a thing, it's quite like topical, and I think it's quite good as we're trying to figure out how everyone works together and discussing that with the people that you will be working together with. I think that's probably the session if you're wanting to go wider than this sort of network, and that would be the one that I would say.
Okay, now that's really useful actually, because whilst PHM has been around for a few years now, I mean like 3-5 years, obviously there's population health before that, it's kind of like predecessor. I think I reckon there's still a lot of people out there who don't get a full grasp of what it is. Just because they've heard the term, it doesn't necessarily mean that people know what it is and how they interact with it. What does it mean? What does it mean to them, kind of thing.
Exactly.
So I think that session where you say session number 2, which is accessible to anyone, if you have people who you work with who are non-analysts or analysts, collectively, if you have a joint understanding of what it is and how you might do it or implement it, then I think that'd be really beneficial. Just on that, actually, this is somebody has asked how, in fact, PHM is relevant to somebody working in an acute hospital, in an acute trust. So I've got 1 or 2 thoughts on that, but I've also had conversations with people in the past about how is PHM relevant to somebody who's in an information team providing supporting the scheduling of elective surgery, for example. Is this a horrible question for you, or is this something that you'd like to talk to us about?
Like, I think one of the best things that can help acute hospital is if they don't have patients coming through the door. And I think PHM is, like I was saying earlier, a lot of it is about understanding your population and preventing ill health. So if you're stopping people from getting ill, then it's beneficial for us, the system, and beneficial for our patients. So I think if we can get more people from acutes interested in PHM, then it's going to help them also. But I understand a lot of acute priorities can overshadow PHM. So I understand how it can be tricky to spend time on this sort of thing. But I would encourage you and your colleagues to try and get interested in it as much as you can.
Okay, that's I'd agree with that. And actually, also when you think about the sort of the PHM in a sort of broader sense, there are examples of where you would want this potentially this kind of approach, for example, to look at elective waiting lists. So what can you do with your management of a particular elective waiting list to improve health inequalities and this is not new stuff, but it comes under PHM. So I think sometimes it might not be called PHM. But this is there are many, I think, specific examples of how in an acute trust there can be this can be applied to particular parts of clinical patient pathways. But yeah, in the bigger sense, stop people from getting there in the first place, sort of thing. Okay, now that's really helpful. I do have sort of several other questions. So should I just now I could share my screen, but in my experience, it's difficult to sort of navigate. So if you're okay, I'm just going to read a few out, and we'll sort of take it from there. Okay, so I mentioned before about the observation that these courses would be very relevant to non-analytical colleagues, and how do we tell them about it? That's something we've got to work out. So that's something we can work out on now going forward. We've talked about the numbers. Someone said it was helpful to flag the technical and non-technical sessions, which we are doing, or trying to be as clear as possible about that. I mean, okay, sometimes it says technical, non-technical, sometimes it says analysts or anyone, but it's the same categories. Yeah, so someone, again, they're asking, would the broader sessions be of interest to commissioners and practitioners as well as analysts? I'd say definitely.
There'll be even better sessions if you can get, if you can get a wider perspective, there'll be even better sessions, because you'll be, what's the word? Like simulating those conversations, because you'll be talking to the people that you'll be wanting to have conversations about when you're actually doing this work with. So it's, if you can get them there, that'll be even better.
Yeah, so go ahead and invite people to those sessions that you think would be interested in them and that you'd be working with. So again, there's a comment about the health economics one would be useful for finance colleagues. So I know we do have finance analysts sort of in the network, but there might be some other colleagues, because many people have analytical skills but aren't called analysts as well. And someone says, after this, if you go on this training, can you call yourself an expert in PHM and health economics?
Yeah.
Yeah, why not?
I think if you go through all of the training, you will have, especially as an analyst, you will have all the skills to be able to go through a population health cycle and lead your team through something like that. So yes. But
I'm presuming in your during the training you give like lots of examples of how it can be applied and what other people have done. So I think that's really helpful, isn't it? If people can see what other people have done, and the impact it's had as well.
Yeah, and it is like PHM in its nature is something that's iterative and that you learn from. So, but in terms of understanding like the core of PHM and how to do it, yeah, I think like in terms, especially the making sure you go through the whole 11. You like I said, you'll have a well-rounded approach in terms of the whole cycle. But yeah, there's obviously still things you can learn in terms of there'll be more examples you can learn from other systems. But yeah, if that was the question. I don't want to say don't do any more learning after this.
No. Then I imagine after you've done the training, it's all about how you apply it, isn't it? It's about building it into your work program and getting people to see that this is a technique and these are the techniques that we should be using, and we'd be really with confidence.
Yeah, exactly. And we'd be really interested to hear about how you take it back to your teams and apply it exactly. But yeah, I think, yes, you will be yeah, you'll be expert, but don't say, okay, I'm not going to do any more learning now.
No, absolutely. So just briefly to mention to sort of you and others, we are looking at all of our training programs to see how they correlate and can complement sort of analysts' competencies, their profession and their professionalisation of analysts. So we as we things will look a little bit different in the future, because you'll be able to see quite clearly how something will satisfy certain criteria of, for example, being professionalised. But that's something we're working on. We don't want to sort of do it. I was going to swear then, in a half way. Anyway, got a couple more questions. So I'm going to go through these because I've got one or two things I want to mention at the end. So one question or point here is, sounds really great, thank you. Will it be all based around NHS data, or will any of the much messier social care, VCS and public health type data be brought in?
In terms of examples, 100% yes. Lots of the examples we use are specifically not NHS, to highlight how you can do it different, like do it using other systems. In terms of what David does, I might just defer to David if you're still there.
So yeah, we'll be for discussion. We'll very much be talking about how the world is big and complex, and I'm a strong believer in how the NHS needs to start opening the doors to other data sets much more. Just to give sorry, let me go on a very tiny tangent here. Some areas finally are starting to bring in housing data. Now, we've now known for what, 40-50 years that housing is one of the biggest determinants of health, because if you live in a cold, moldy place, you're going to get ill, period. And I find it a bit embarrassing that it's taken us so long to even start asking the question. So yes, absolutely, we'll be talking about the importance of looking at the wider data sources. For what concerns the technical part, our focus is going to be not necessarily on the data engineering. It's going to be more on the analysis. So our focus will be more on the techniques used once you have the data in one place. To be fair, there is potentially a space for a separate conversation, maybe a follow-up mini course on understanding wider data sources and understanding the data engineering and pre-processing steps necessary. But for this course, we're not focusing necessarily on what that entails. We're just bringing an appreciation of how the data world required for PHM is big, but not going into the weeds of how to tame that unwieldy beast.
Yeah, I think if you try to do that part of it in this session, it would take up most of the session. I mean, sort of gathering data, cleaning data, and I think just understanding the fact that you do have to get it into a format, and data can be very messy and incomplete, and that's, I mean, we all know all about that. But that's very helpful. Thanks very much. So someone's just just checking that they don't have to go to all of these sessions. They can actually pick and choose, and that's exactly what it's a menu, isn't it? It's a menu of fantastic training that people can choose from according to their particular interests and experience, with the knowledge that some are technical and some are non-technical. So people can pick and choose. They can come to one, they can come to all, or they can go to several.
So yeah, that's a good point. I think if you feel like you are really versed in PHM but don't know how to do impactability and the causal inference stuff that David was talking about earlier, you're welcome to come to those two sessions, like the kind of broad session and that session. Or if you just want to, you know, have an introduction for now and get your head around that and then learn a bit more later on, then you're welcome to do that. Or if it's just the broad sessions, so that you understand what a PHM cycle is, but you're not interested in the analytical part because that's not your role. All of those are welcome.
Fantastic. Yeah. That's great. Somebody has said, thanks, Sophie, for the answer on acute. I agree. So this person, it has relevance, but just think we need some more narrative to explain why we should engage more. And I think that is a fair point.
Mm-hmm.
I think because I've had that discussion with many people many times, I think it isn't clear. And I think you can sort of make it absolutely clear and relevant to everybody who needs to be involved or should be involved. Because it's all very well saying PHM is everybody's business, but unless you know what your actual role is in that and how you can use it or apply it as a technique or as part of your work, you're not going to, are you? I mean, you're going to be, you're too busy doing your day job. So making it relevant and making it clear, I think that is definitely something you're probably going to be doing through the training, but I think we can do beyond that as well. David's got his hand up. David, did you want to come in there?
Yes. So just as a direct answer, response to the person who posed the question, I'd be delighted if they're having a conversation with the organization to put together a couple of paragraphs. I'm sure I can get a few sentences together with Sophie's help in the next few hours. And also, while I'm here, mini tangent again, Sophie, I think there's a blog here that we can pull together, and I think it's going to be something that a lot of people will want to read.
Absolutely. Yeah, well done. Yeah, thanks, David. That sounds fantastic.
So yeah,
and I love that
you are, if you want to get in touch directly with me, I'm very happy to help.
Fantastic. And I love that you're committing Sophie to work today. She's already told me how many meetings she's got, so this is great. It just gets better. So someone's just confirming that finance people do very much get involved with analysis, just separate to them as analytical teams. So they might miss these opportunities. Now we do have, in the Analyst network. I mean, that is not the Midlands Analyst network is self-selecting. So we get groups of people, groups of analysts, and big gaps. And so we know that we don't reach a lot of people if that's the route that we're sharing things via. So maybe if finance analysts were more sort of like presented represented in that group, that would be helpful. But again, I totally agree with that. This is about sort of trying to get that message to those people. So maybe we approach directors of finance and just say, could you disseminate to your teams? These look like fantastic offerings. I couldn't agree more.
Thank you.
Okay, so there's just a comment. I think we probably covered it, but someone's asking, is it just the technical sessions that are capped at 25? And it is. So we've talked about that one because you said that they had to be well behaved. I'm sure they will. Do the courses include practical examples of projects, PHM and health economics, and how they've been used? I think you do. I think you use a lot of examples, don't you? Because that really helps learning, and it helps people believe as well. So it's not just helping people to learn how to use and apply the techniques, but it's also believing in this as an approach. It works, Yeah. Yeah. Sometimes we don't state the obvious, do we?
Yeah. I might actually share one example because when David was talking about like mouldy housing earlier, there's an example that we always talk about. I might just pop it in the chat. That's about somewhere, it's in the northwest and I can't remember exactly where, but they did a piece of work which was boilers on prescription. So they used and helped people with boilers and a few other bits and pieces, basically to keep their houses warm in the winter. And yeah, it was really effective. So I'll try and dig that out and put it in the chat, or either share it with you, Rachel.
So share. You can put it in the chat, but I'll share it afterwards as well, because
we've got tons of those, but yeah, that one's one of my favorites.
Yeah, and so there are health benefits, and also obviously there's going to be economic benefits as well. This is the whole point.
Exactly, going back to that pie chart of like things that affect people. A lot of the time, it's the PHM interventions are in those those bits
80%
really make a big difference. And it's things like putting handrails in when people are getting like full hip replacements at like 90 years old. Like they don't need that. They just need like a better system of getting down the stairs and things like that. So it's just understanding your population a bit better. But anyway, I'm doing a David. I'm going off.
No, that's absolutely fine. That's fine. And of course, as well, I'm from a public health background. This is all it's very familiar territory. But with more people doing it, more people involved and getting interested in seeing and believing in the benefits and everything, it's going to be so much more powerful than just sort of public health colleagues trying to do a lot with a limited number of people and resources. So someone's saying that they're going to be on they're very interested in the course, but they're going to be on leave for a couple of the sessions. And are we going to be recording them? I think we said we are going to be recording them, aren't we?
Yeah.
Okay.
Yeah.
Fantastic.
Happy to be recorded. Yeah, the team's happy to be recorded. Yeah, all good.
Someone is pointing out here that this is great for analysts thinking about AFA professional registration. Great courses to show engagement with CPD. Yeah, so that's something we really want to do a little bit more of, is just have clear line of sight between the training that people are receiving and CPD and professional registration and others. All right, and somebody is saying it's a shame that some of these are on the same days as other MDSN training courses in Insight Week. Yep, this is true, and this is almost like a seamless link into. And you haven't reminded me, Sophie, that Insight 2022 is on the 2 weeks between the 3rd and the 14th of October, and one of these sessions is during one of those weeks, but I'm not sure. I don't think it won't fit. It doesn't compete with an actual event anyway. So if somebody wanted to do that, that'd be fine. And both are recorded. That's also fine. And it's going to be repeated in January. So we have many options and solutions here. But Insight 2022, do get registering your interest in the whole event. It's shaping up very nicely. We've got lots of fantastic speakers already, and there's still one or two sort of to be confirmed. So look out for that. So there's no more questions, Sophie. Is there anything else that you would like to say before I just do a close our session today?
Just look forward to seeing you all, well, lots of you hopefully, over the next few months in these sessions. I might just see if David and Lisa want to say anything as well, if they want to come in. No, all good, just waves.
Just wave. Well, I've just got a couple more things to. I'm going to do that funny thing where I'm sitting in front of this again, so I can point to it, can't I? So this is just what's coming up in the next couple of huddles. So we've got actually this is you again, Sophie, in 4 weeks anyway, isn't it? The analysis of North West London ageing population.
It's not actually me. It's
okay.
I didn't do
one of your guys.
I'm not clever enough to do that. It's going to be Santosh and Nihan, who've done a really good piece of work using survival analysis. So I think they're going to go a bit through what survival analysis is, and then how they've used it for this piece of work. So it should be a good session. It is a technical session. So
okay.
I'll
make that clear.
In terms of like just a bit of an analytical background would be preferable, just so you can keep up with the survival analysis bits and pieces. But yeah.
Okay. That sounds great. And then we've also got coming to fruition Midlands Decision Support Network analytical projects. There's two which are just about to be completed before they start the new ones, which were selected a month or so ago. So we haven't presented those reports for a while, so I'm really looking forward to that. We've got a lovely picture of all these happy and very hairy people, actually. So this must have been a bit lockdowny. And then just finally, I know we've hit 12 o'clock. Really, the there's a lot of training out there at the moment. We really want to draw people's attention to it. The prospectus is out, it's still out. We're updating it all the time with dates and registration information where it wasn't there before. Just want to, apart from obviously the PHM course, so that introduction is on the 5th. So please register for that. There's a link here. I don't know if people can you actually click on these links. I know I can. But it's all on the website. If you go to the MDSM website and training and events, all of this information and access to the to registration forms is available there. But I also want to draw your attention to this introduction to data science. We have spaces now. This starts in a week on Monday. Yes, it's 8 half days. So I think it's on a Monday morning for 8 weeks now, which feels like a big commitment. But after having done something similar on a Monday afternoon for 12 weeks, it's actually the rhythm and the time you spend doing it. It's not onerous, and it's good. The spacing works really well if you're building, you're learning on certain things. So I would 100% recommend you take a look at that introduction to data science. You don't need R. It's helpful if you have it, but you don't need it. You'll learn it. And then, so mention this one. We've got a Google is Goodish. This is really cool. 1 hour presentation on the 9th. Just book yourself directly via Eventbrite onto that. You don't have to go via me. So I don't say yes or no. You can just book yourself on. That's fine. Leadership development for analysts. 2 cohorts. The next one is in November, or you can hold on and come and join us at the residential in February. That's exciting, isn't it? And there's various other courses. Check out the website, but in particular, look at the introduction to data science, because we have spaces, and they will fill. So if you want to do that, because they'll fill, because I'll be emailing the Analyst Network today or tomorrow, and then they will definitely fill. So get in there is what I would say. Okay, I'm just going to stop sharing my screen. I've gone over by a full 2 minutes, which is outrageous. But just thanks very much for sharing that with us, Sophie. It really does look like a really good course. We've been waiting for this, haven't we? We've been planning it, we've been designing it, so it's perfect, and it's been tried and tested in different contexts. So thank you very much for that. Thanks, David, and thanks, Lisa, for coming too, and thanks everybody else for coming. And I'll see you all in a couple of weeks. Bye.